Hi there. This video is an introduction to the reports that were used to process pathology. We've done a lot of work on this recently and tried to make it really consistent. And the idea is that if you get your head around one bit of it, it's not too difficult to move to another. Now, I'm going to start by showing you probably the simplest pathway, really, which is vitamin D. So you need to be familiar with clinical reporting, and we've got other resources to help you with that. If you come to our Wellbeing Innovate reports and then pathology, and then you've got the folder for vitamin D. Now, in this folder, there are a lot of zeros, and that's very deliberate. What we're trying to do in the way this is configured is only bring into reports the patients that you need to do something with. And part of that as well is to do with reflecting how you work as a practice. Every practice is different, and there are different approaches that you might want to take with this. What we've also developed to go with this is this planner. And there's a page for each result. And the default is that you're not using it. So if we don't know and we've not set it up for you, the system will assume and be configured so that actually there's no patients at all in the reports to review, because we don't want you to be accidentally filing things without doing the next bits that are needed. So when we've gone through it and enabled it for you, you can change this to full system. Light just means that we're filing the satisfactory results for you that don't need any action, but you then need to pick full system. And then there's a couple of options here. And again, this needs to reflect what you've told us and what's in the system for you. So I'll do this for our practice so you can see how it works. So we've said that we do want all of those patients to go straight to an appointment, but we don't want that for the prescribing review. Now, by doing that and putting in the yes, that's grayed out this section. And if I look back in the reports, you can see here this section are all zeros. Now, that's not because there are no patients in those categories. It's because our configuration is for those patients to be invited for an appointment. The way this has been configured is that we've directed those to a GP or clinician appointment. And so they will be in this overview folder and these invites to send in bulk or letters. So GP appointment repathology or a letter. They will also be in the recall system. So if you're already using recall and the section for other and the follow-up invites, again, the patients will be in the same relevant reports there. You don't need to do both. You can just pick which you're doing. Back to vitamin D. So I can see here there's some actions for admin staff. And for all of these, we're trying to make it nice and clear what it is you need to do. This is a slightly unusual one, but you can record no further action on the template when that's been done. Retrieve and save is fairly consistent across all the pathways, and these are for automations that you as a practice have opted into. The way this works, so we've said, for example, we want to automate the sending of messages about vitamin D supplements. So again, because we've done that, there's a big fat zero there. No patients are going to appear there because we're not sending them in bulk, we're doing them via messages. Patients may appear here because we can't automate sending of letters in bulk, but at the moment we're on top of that and that's got zero. The way this works then is that patients will appear in here when it's a week since the latest vitamin D result, and there are automations to run. It might be sending messages, or it might be calculations to do, or diagnoses to update, things like that. It depends a bit on the pathway. Either way, it's a really simple one. You do what it says, you retrieve the record, you hit save, it does its thing, and you just work through the list. This next section here, these admin review, so these again reflect how you might be working, and if you're not working in the appropriate way, no patients will appear in here. So it might be that you said as a practice, you want to task your GPs to review patients. We've done a separate video on how that works, but once we do that, if they don't deal with it within 4 weeks, or say they do something with it, but it's not recorded properly in the system, then they would drop into these reports to review. And it might be that you can see that indeed the patient has been reviewed, been spoken to, and you can just update it in the relevant template. The non-responder ones, again, these will reflect how you're working. So this would be if, say, for us, we've said that these patients are going to have an appointment with a GP. We've only just started with this new approach, so that's why there's no patients in there. You may take a decision as a practice to say, look, they're going to have 3 invites. So if they still don't respond, well, then that's fine. That's the patient choice. There is only so much we can do as a practice. But if you do want to review the patients, then the lists are here. And from there, again, you might want to pass it on to a clinician. You might want to look at it further. You might want to call patients. It's really up to you as a practice how exactly you want to work. We're trying to give you the tools to do it, the reports and the templates you need. But a lot of this is down to you as a practice. The idea then is that in this template, in this spreadsheet, you can start to decide what you're doing. So it might be something like, oh, hang on, no, these are admin drops down. So action from report, that would always be an action from report. Some of them you might just say not needed. And we're not going to use those because actually we don't think we need to do that. We're going to leave it with the patient because they've got some responsibility as well. For our practice, that is action from a report. This is to prescribe vitamin D loading dose. So one of our pharmacists, Sergio, will regularly work through this. And you can put in here as well if you want to, like how often you do it. For us, it would be Sergio. I could put today as the date it was last done. And then the date that it's due will automatically update and the status will update. So if I put this at, say, I don't know, the 1st of September and it had not been done for a while, that would show then as overdue. So if you want to, you can use this as a tool for kind of audit purposes to record what's done and why. You could save your own practice version of this somewhere in a SharePoint, and then it might be that multiple staff work off it to update what they've done. Again, very much up to you how much you want to kind of use all of this. You don't have to use it, but you may find it useful. Certainly, we think it's helpful to kind of put in here what you're doing and so on. Generally, the report name will be telling you sort of what's going on with it. In the relevant template, it should make it clear for the clinicians. Again, we've done videos on that. This is more about how you as a sort of admin team or individual are working through these and making sure that things are done appropriately. Some of these as well are not essential. So this one says like not essential. Again, you might decide as a practice we're not going to use that. Some of these, so again for us, it's not in use, and we could put a little note, automated. We've opted into the automation for that. Letters, you need to action from the report, and it would be send comms. And again, we'd probably say to do that every 7 days. We don't want too much of a delay, and it might be, for us, actually that's a job that ARPA, our bot that we're developing, does. I'm not sure offhand when ARPA last did that, but I can always check that if I need to. Just one other thing to kind of flag up really in this video. If you want to understand and check how you work and what your setup is, if you come back to System 1 and go to the folder Localization, and you can go to the relevant result, like here we've got vitamin D. If you run these reports, they shouldn't take too long to run because they're not complex. They're really just looking at what's your practice setup. Where you are opted into an option, generally you will find a pretty high number, often roughly your list size. It might be smaller, but it will be a good number of patients, at least hundreds, I would imagine. So I can see for us, for example, we've got the automation configured for the result message. And I can also see, like I said, that we're directing all clinical reviews straight to the appointment with a GP. If your options in here don't match what you want them to be, you can't change it directly, you just need to let us know. And in fact, if you typed down here, so we go, Wellbe, Innovate, email, there we go, email support. Clicking that will generate an email from your practice. It's very funky. It puts in your username and your organization code, and then you can tell us what it is you want changing, and we can make those changes for you. If you're using multiple pathways, which I imagine most of you will be, you may also want to look at using this overview section. Some practices have pointed out what can be a bit frustrating with the retrieve and save reports is you go through one list and then you get to the next one and realize some of the patients in there have already been retrieved and saved. So this one pulls together, it's a bigger report, but all of the possible outcomes that need that doing for all the different pathways that you've enabled and all the automations you've enabled. So again, once a week, probably at least, that's one for someone to clear. Again, you can decide as a practice how you want to work this. We can help you and talk you through the different options and what all these things mean. But we hope that sort of once you've done that initial work of deciding how you want to work, of putting it into the spreadsheet, then you should find that it's a fairly straightforward thing to keep using and keep up to date with. Hope that helps. Hope you followed it. Rewind, watch again as needed, and give us a shout if you're still stuck and need a hand. Thanks.